Of course. So I'm Walker. I'm the executive director here at Kids Hurt to Hawaii. Our mission is to strengthen connections to the community by bringing together children, teens, and their parents impacted by grief and trauma in safe and healing ways. Our vision is to restore healthy growth and development in children with grief and trauma and stabilize families in crisis. It's a big one for us now. So we believe that grief is a natural process that we all must go through in our lives, whether it be because of death or because of the loss of something else very, very dear to someone. In addition, trauma recovery, also a very natural process that most of us will have to go through. And we believe that through therapeutic groups, our school-based peer groups, mentoring activities, community building, workforce development, and resource referral, we can begin to address this and really help others and help youth and families on their own healing journeys. These journeys are never ending, and sometimes they're big highs, sometimes they're big lows, and you can be in the shower 20 years after a loss and it suddenly hit you and you start crying. But all of that is very natural. Um, Note from our founder, we can't prevent domestic violence, victimization of children, and loss of family members, but we can provide these resources and help children cope with those difficult situations. And that's kind of the underlying theory and the underlying thought behind our peer support groups and mentoring activities. Um, so our services are intended for children and teens ages 3 to 19 and their caregivers. And these are our base services that we conduct in town. I'll go into our school-based services in a little bit. And those are for youth that have experienced loss of an immediate family member or household member. So either the death of a family member, separation from a parent due to incarceration, divorce, abandonment, domestic violence, deployment for those military families or separation from both parents and the children are in foster care, kinship care, or adoption. We have specialized services for youth that have interacted with the foster system or are in kinship care, and we also have specialized services for queer youth, LGBTQ youth. All of the youth enrolled in our support group services are allowed to participate in our mentoring activities. We have Surf for the Soul, which are um, the youth going out with either other youth mentors that have come through the program or through one of our partner programs and learning how to surf, kind of learning how uh, to deal with life coming at them just like a big wave and having to get back up on the board. Those are very, very good lessons that build resilience and help the youth down their life journey. We also have Poi for the Soul, which takes the kids out to Alo'i, and from planting all the way to pounding, we teach them about kalo um, and get into some of the cultural practices and lessons around that. We also have Seeds of Love, which is our gardening program. Ho'eva'a, so we have paddling, and we partner with local paddling clubs to get our youth and our families engaged in those activities. And then we also have community and cultural engagement activities such as tutoring, ukulele lessons, judo, and much more. If a youth or family member comes to us and they want to do an activity, we do our absolute darndest to make it happen for them. We want to give youth and families as many opportunities for amazing, great, fun activities and memories as we possibly can. Um, Essentially, we are working to combat the compounding impacts of ACEs with everything we have. So the idea being that by providing these amazing, great um, memories and activities, we can both build community, build social capital, but also create those memories that they will cling on to and have for their entire lives. We do our best to make these events very, very special. So in addition to partnering with youth mentors, we partner with celebrities to get a lot of them done. So we work very closely with Billabong and the World Surf League and the Andy Irons Foundation, as well as the Eddie Aikau, to have professional surfers come teach the kids how to surf and surf with them. And these are long-term commitments. So the kids actually are able to interact with these pro surfers over multiple years, and developing close personal relationships with them. That's really beautiful. That picture that you see there is Zeke Lau, and he is working with one of our fire impacted youth. And that's following the Lahaina wildfire. Um, core uh, underpinning belief and idea behind our programs is restoring hope. So, children impacted by abuse, neglect, domestic violence, historical traumas, and sexual assault engage in therapeutic peer support groups designed to calm the nervous system, and get the body back to a point of better self-regulation. And what that looks like in a lay context is essentially youth being able to have hope for a better future again and feeling it in every fiber of their being. So our model is unique. It is based around strengthening families by gaining input on family needs, offering resources and tools for effective communication and parenting, and recognizing the importance of family in children's healing process. We measure this through the Protective Factors Survey, and so we have our participants take that at regular follow-up intervals, and that allows us to adjust each program as needed because each group is unique. And we create a safe and nurturing environment through these support groups and mentoring programs for the children and teens to be able to freely express themselves, develop better coping mechanism, strengthen their emotional and social well-being. And then we also offer concurrently, while the youth are in their support group, a group for the caregivers. So the youth are what happens in group stays in group. So the youth don't share what happens in their group with their caregivers. The caregivers don't share what happens in their group with the kids. We do have parents that sometimes try, but the youth are pretty good about not talking about it. Um, and then each youth group is structured by both type of loss and age group. So youth are in groups with other kids their age, and then other kids that are experiencing the same kind of loss or impact that they are. Um, and we also work to empower caregivers, teens, and children using a holistic approach to aid them in navigating their grief journeys and trauma recovery with resilience and hope. All of that is to say, we surround all of these kids with unconditional love and give them as many resources as we possibly can to succeed. It's our goal that Kids Hurt to be the safe space for them no matter what is going on in their lives. That means we have the unique rule of nobody getting in trouble at Kids Hurt too. If we do have rules for group, but say a rule is broken, the worst that it ever gets for kids or the worst punishment that they might receive is a brief pause. We may take the youth aside and ask them, that was a rule break. What rule did you break? Have them say back what rule they broke, and then say, okay, go play. And that's so that we are always, always, always that safe space. Because once that trust is broken, um, it can never really be brought back. Definitely not in the same way. And it takes 1,000,000,000 I love yous to overcome one simple I hate you or I don't want to be around you or a traumatic punishing process. Oops. So that's how our traditional groups function in our town-based programs. And we have also launched our school-based programs, which are focused services for underserved populations. And we've developed them in partnership with community advocates and cultural practitioners that are on our staff. And we've adapted this programming to specifically address the intergenerational and historic trauma felt by Native Hawaiian communities. And this allows us to build back a connection to a cultural identity that may have been lost. And through the use of these cultural practitioners as group facilitators, we weave these traditional practices, such as Oli, into our groups to address the grief felt from loss of kingdom, loss of land, loss of community, loss of language, and more. Each group is specified to the school. Each service that we provide the schools are specified to the schools and that community. We work hand in hand with the school's BHS staff, the counselors, and the principal to develop a support group program that works best for their student body. And these services are conducted in school, during school, and after school. So we have an agreement with the DOE that allows us to conduct these services during school and take the kids out of class time, which is a beautiful, beautiful gift and big note of support on the DOE's part. And these services extend extensively through the Waianae Coast. We are open to other sites, but again, that's based on the principal and counselors. So as I said, these school-based groups are tailored to meet the specific needs of each individual school. Um, Successful collaboration between Kids Hurt 2, school administrators, faculty, and staff is key to providing beneficial groups. We work very, very closely to plan not just the support groups themselves, but also the additional mentor and community activities. So the images to the right here are from one of our large festivals that we did out in Waianae. So this was at Waianae Elementary. We had 600 participants at that particular event. That was our first kickoff event, and over 30 partners sharing resources. Our programming functions to bolster the school's mental health capacity. So we're not trying to supplant or do anything that replaces what they already have. Our goal is to allow the counselors to focus on the most needing cases, and our programs catch the kids that may not present as needing an external intervention just yet, but are identified as probably needing services. These groups, as I said, run both during and after school. The schedules are set in consultation with the school officials to best complement the youth academic performance. And we do actually see pretty big impacts on the academic performance of the participants. So schools have reported increased attendance rates by participants. After that first Aloha Ia Waianae festival that we did at Waianae Elementary, school-wide attendance increased by 16% for 6 straight weeks, which was a pretty big accomplishment given the attendance rates observed along the Waianae coast. Participants themselves report improved happiness and well-being in the classroom. Teachers report fewer behavioral incidents from participants. Also reported are improved mentality towards schoolwork by the youth. So they want to go to school, they want to be there, and Initially, it's usually because they want to go to group and they want to go, play with group and be with the facilitators. But we find that that actually spreads well beyond the boundaries of the group itself and helps to have improved classroom behavior just across the board. So in the first 6 months, we observe improved protective factors based on, again, the administration of the protective factors survey at this follow-up interval. So that measures these four specific metrics of resiliency and well-being. So for family functioning and resiliency, we see an average of a 21% improvement in the first 6 months. Nurturing and attachment, a 36% improvement. Social and concrete supports, a 14% improvement. And then child development and knowledge of parenting, a 26% improvement. Again, these are averages taken from our school-based programs, but they're pretty big improvements across the board and on every metric. So we're very, very proud of that. We also offer crisis management. So we assist schools, community orgs, and families with helping children after homicide, suicide, accident, disasters. Not only did we respond to the Lahaina fires, but our organization also responded to the tsunami in Japan after the tsunami that caused the reactor meltdown. Our organization deployed out over there, and then that is the same model that we used for Lahaina and how we ended up running programs out of our converted bus and a mobile unit. Um, these services are available on request. They are free, um, and all anyone has to do is call the main line. So I want to talk story a little bit about trauma and the body and how our bodies, I think we all know that our bodies can store trauma, but also how that may present differently in children and youth, and how the symptoms and signs that you may be looking for in clients or in youth may not be the signs that present just because so many adults are so trained to look for the things that they have experienced or are experiencing. And they might not realize that a youth with, say, a tummy ache could be a referred trauma response. So grief and trauma live within the body. So the spirit, emotion, and the body are not separate. At Kids Hurt 2, we see these very much as a continuum together. And when pain is carried, it's carried to every part of the person that bears it. I think that we've probably all experienced something large and tumultuous in our lives that we have felt through every single portion of our life. And it impacted our work, our personal lives, and our physical well-being. So trauma is primary. It binds itself into the i'o, the flesh, the uhane, the spirit, the na'au, the gut, the iwi, the bone, the pu'uvai, the heart, the ha, the breath, and the kino, the body. Together, these carry the trauma that has been left within by the past events and by the difficulties that we have experienced. Pardon my olelo. Trauma work needs to focus on the body, kino, because that's where the trauma lives. That's where we hold it. Trauma work must involve the ho'oku'u, the release of what is stored in the flesh, the i'o, the iwi, the ha. And so that goes back to our holistic principle of just trying to surround the youth with as much love as possible and allow them the space to realign their body and allow them the space to overcome some of those physical symptoms that they're experiencing and better regulate their nervous system. So the Na'au, the gut, holds memory, emotion, and intuition. And we believe that trauma work must reconnect one to the feelings stored in their body and bring them back into balance. And this is part of the reason why I used the tummy ache example earlier. Because the gut and the body stores this kind of deep-seated there. That's actually a very common way that youth can express their internal strife. Trauma work also needs to focus on building Palina. So trauma disconnects us from our Ohana, our Kai'ulu, and Aina. And we believe that trauma work involves focusing on repairing these relationships. If you'll look below, these are pictures of some of the relationships we've built through the West Side in our work. Um, Sadly, we can't share too many pictures of the kids because it's in school and we can't do that. But we work very closely with the community, building that Polina so we can then share it with the kids. Our mentors are from the regions that we serve. They are already of the community, as are our facilitators and as are our employees. Um, so if you look over here in this picture, you'll see Auntie Nani and Uncle Dana, and Auntie Puaena. Um, they are larger figures along the Waianae coast, but they are actually delivering our services. And so the youth already have this pre-existing relationship with them. There's already that trust. They've already had Polina with them, and it helps to get to addressing those intense emotions and feelings with the youth that much faster. So the uhane, the trauma disturbs Polina with your uhane. So healing requires restoring connection through processes like ho'oponopono, pule, and ceremony. And as I spoke before, we do incorporate these into our practices as requested by the schools and the community, if it so fits. So they are extensively used in our West Side programming. They help to reconnect the youth to their cultural identities that they may have lost and help to supplant the possible negative identities that they've taken on. So especially in West Oahu, with how the media talks about Y&I, the kids take that in and they can often begin to internalize it and think negatively, not just about themselves, but about their community as a whole. They take it on as their identity, and that they begin to associate themselves with that feeling of worthlessness that the media often uses to talk about their home and their people. And so we work very hard to reconnect them to their past culture that they've lost and give them a better identity that they can be much, much, much more proud of. Uh, so ho'o mana'o, so remembering integration. So true healing gathers kino, na'au, uhane, and palina back to alignment, restoring pono and balance in the body and the mind. If we don't understand our own trauma or grief responses, we have difficulty understanding others. We work very diligently to ensure that as the youth begin to reintegrate into their bodies and into their communities, that they pass this on and that they express themselves with an empathy first mentality, so that they can better understand those around them and understand the difficulties that those around them may be experiencing. Um, our organization has been around for 25 years now, And we are very, very proud and happy to report that a large amount of our mentors and group facilitators are previous clients that have aged out and come back to pay forward and give back to others what they were able to receive growing up themselves. So, some types of traumatic stress, community violence, complex trauma, like all types of child abuse, abandonment, neglect, and domestic violence, traumatic invalidation or violation of trust. That's a rather large one, especially when it comes to identity. Um, so something that we have observed West Side, that a lot of youth sadly have reported, um, is the experience of being told that they're not Hawaiian enough. Um, Also, medical trauma and the pandemic, that was a very, very large upheaval of people's lives, and I think we all can remember that. Disasters are another type of traumatic stress, school violence like bullying, terrorism, traumatic grief from violent deaths. To use West Side as an example again, um, the community as a whole is grieving intensely over multiple both deaths and then also losses from incarceration. Sadly, when violent incident happens and it is broadcast over the media, usually it's not just the victim that is lost, it's also the perpetrator to that same community. And these have to be addressed. These have to be worked through by the both the families and the community as a whole. And coming toward the end, so Kids Hurt 2 offers educations and trainings similar to this. So workshops, presentations. We have grief and trauma facilitator trainings, and those are 2-day intensive trainings on our very specific model. So we utilize youth-led play. My apologies, I should have said this at the beginning. We utilize youth-led play in our services, and it's just a safe space for the youth to play through and process what they've been through and experience that unconditional love and that unconditional support and attention. And we do our Healing Young Hearts presentation like this, discussing grief, trauma, play, and how our services work and address it with children. So facilitator trainings coming in 2026 are to be announced. They are free. You can register by calling our main line or by sending an email to info@kidshurt2.org. And that is also how you can refer any client. They can just call the main line and we will start the intake process. Our intake process is very, very simple. We just ask the clients what the age of the youth are, why they're calling, what particular service they're interested in, and then we will assign them to one of our groups. And then during that first group, the caregivers will complete the rest of the paperwork.